So last night was Halloween for me, and I actually got a hangover from eating too many Kit Kats. I didn't think that was possible, but I guess it is. And coincidentally, this scene is a Halloween themed scene. So that means I have to spend the next few minutes talking about candy. I literally am on the verge of vomiting. So I'm going to try to get this over with as quickly and easily as possible. The scene is called Phyllis's Chocolate Covered Cherries, and it's about Haemophilus influenzae. So the story of the scene is that some kids are trick-or-treating at Phyllis's candy shop. You may notice that we're using a lot of reddish and pink hues for this scene. This is to help you remember that Haemophilus is a gram-negative bacteria. So we've named the store Phyllis's Candy Shop after Haemophilus, or Haemophilus. So let's get the store name up there. Haemophilus is often described by its characteristic coxobacillary shape. This means its shape is in between a cocci and a bacillus. To remember this, we're going to put a big candy machine right up front, dispensing candies that are in a coxobacillary shape. We've also made the machine in the same shape, and we'll put a big sticker on the front of it with an enlarged image of the candy so you can clearly see its shape. Haemophilus requires a special media to grow. You should know that it's grown on chocolate agar, which requires the addition of two special factors, factor 5, which is NAD, and factor 10, which is hematin. We're going to give you an easy way to keep this all in order. We'll make the candy shop specialize in chocolate to help you remember chocolate agar, and we'll add it here on the window. Now we have to illustrate factor 5 and 10 and give you a way to remember what each of them are. First, for factor 5, we're going to turn this circle above the candy machine into a nickel. A nickel is worth 5 cents for factor 5, and the name nickel will help you remember nicotinamide in nicotinamide adenine dinucleotide, or NAD, so you can make the connection that factor 5 is NAD. Okay, what about hematin being factor 10? Well, if you remember the 10, you can remember the factor is hematin, or hematin. So to remember factor 10, we'll have Phyllis selling her chocolates for 10 cents, or 1 dime. We'll add the sign here for now, but we'll draw the chocolates in a little later. Before we jump into the diseases caused by Haemophilus, you should know that the infection is primarily transmitted by aerosol transmission. To help you remember this, we'll have Phyllis using an aerosol spray over her glass. You'll see exactly what she's spraying at in a little bit. Since these droplets first go to the respiratory tract, it should be easy to remember that Haemophilus can cause pneumonia. But there are 3 more disease processes that you need to know about. And we'll use some trick-or-treating kids in costumes to help you remember them. One of the most high-yield manifestations of Haemophilus infection is epiglottitis. As far as this step 1 is concerned, if you hear epiglottitis, it's caused by Haemophilus. The symptoms of epiglottitis include inflamed epiglottis, inspiratory stridor, and drooling, and it usually occurs in children. To help you remember epiglottitis, we're going to have a child here screaming. He was already on his toes because it's Halloween, and now he's being spooked by the sudden spray behind Phyllis's counter. Notice we're making his epiglottis visible on the bottom of his mouth. We're also making him drooling to help you remember the major symptoms of epiglottitis. Another way they may describe epiglottitis is by giving you the physical exam finding of a cherry red epiglottis. We're really going to hammer this in by changing the name of the store one more time. Now this is going to be Phyllis's Chocolate Covered Cherries. We'll also have the screaming kid holding an ice cream with a cherry on it that's fallen to the ground. Screw it, let's just fill this entire store up with cherries and chocolate. Alright, that's enough for cherries. Let's move on to the next disease process, otitis media, or inflammation of the middle ear. We're going to have another kid here who's plugging his ears with his fingers because the other kid is screaming. And this is how you'll remember otitis media. Alright, let's move on to the next disease process, meningitis. Meningitis is only caused by Haemophilus when it's the capsular form of the bacteria. And specifically, it's only the type B strain that's associated with meningitis. To help you remember that Haemophilus causes meningitis, we'll have another kid in the store. He'll be wearing an astronaut costume, and more importantly, he'll be wearing our standard recurring symbol, the meningitis helmet. And to remember that it's specifically the type B capsule that causes meningitis infections, we'll have our capsule symbol on the glass case here with a bee flying around it. So that's what Phyllis is spraying that aerosol spray at, And it's also our way to remember B for type B capsule that causes meningitis. That's almost everything we're going to cover for the disease processes. But Haemophilus can also cause other diseases, such as sepsis and septic arthritis, but this is usually more common in patients who are splenectomized. This should come as no surprise to you, because the spleen is required to remove encapsulated organisms. So just like splenectomized patients or sickle cell disease patients are more at risk for strep pneumo infections, they're also at risk for Haemophilus infections. To remember this, we're going to strap some sickles to the two kids here dressed as knights. And these sickles should remind you that patients with sickle cell disease are more susceptible to Haemophilus infections. Haemophilus meningitis has almost all but been eradicated in the US because of vaccination efforts. The vaccine covers only a specific type of capsular antigen, but fortunately it's a type that causes meningitis, the type B capsular antigen. Remember that this is the opposite of the Neisseria meningitidis vaccine. The Neisseria vaccine was for all of the types except for type B. Anyway, so that you remember that there's a vaccine and that it's for the type B capsule, we'll give our Space Explorer a gun that looks like a syringe, or a vaccine. Since he's standing nearest the capsule with the B, you'll remember that the vaccine is for the type B capsule. There are a couple more details about the vaccine you should know. The vaccine consists of a polysaccharide of the Haemophilus capsule conjugated to the diphtheria toxoid, which is a protein that increases immunogenicity of the capsular polysaccharide so that the body can produce a strong IgG response. Additionally, examiners may ask when would be the most appropriate time to vaccinate children, and the answer is between 2 and 18 months. So to remember that the vaccine consists of a polysaccharide conjugated to the diphtheria toxoid, we'll have a sign here that says there's a special for sugar-dipped cherries. We'll bold the dip for diphtheria, and you should be able to recall that it's bound to diphtheria toxoid. To remember that the vaccine is ideally administered between 2 and 18 months, we'll make the cost of the special sugar-dipped treats to be $2.18. So the 2 and 18 for ages 2 to 18 months. I can't say I necessarily agree with Phyllis's pricing scheme here. Chocolate-covered cherries are 10 cents and sugar-dipped cherries are $2.18, and they're on sale. I think Phyllis needs to spend a little less time making candy and a little more time taking an econ class. Anyway, let's move on to the treatment of Haemophilus. In general, you'd use a beta-lactam antibiotic, and for meningitis or systemic disease, you should remember ceftriaxone. We'll use our ceftriaxone symbol, the 3 axes, which you've seen many times before, and we'll conveniently strap these axes to the back of our kids in the night costumes. There's one more aspect of treatment we need to cover. If a kid is diagnosed with Haemophilus meningitis, rifampin is commonly used for prophylaxis of meningitis in close contacts. So to remember this, we're going to draw a kid wearing a cowboy costume, and we'll have our symbol for rifampin, the rifampin rifle, strapped to his back. And take note that he's not one of the kids that represents any of the disease processes of Haemophilus. He's just hanging out with him. He's a close contact. Remember where else we used our rifampin rifle for prophylaxis of close contacts? That's right, in the Neisseria meningitidis story at the college crime scene. Well, that's it for Haemophilus. I hope you enjoyed this one.